You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
Fambul Adu and welcome to this edition of the program Ctn Health Watch, where they reach you from a studio in Radio Mount Oriel, FM 107.3 for Abbey College. Inside today's program, we talk about the work with the World Health Organization they do na the country Sierra Leone. And same way so, the work with the organization they do for help fight the coronavirus and other sickness na the country. Me where they make the program reach you. My name is Zainab Mansari, and with me na the program I get Safia Boy, the communications officer for the World Health Organization.
The World Health Organization na indeed before well body business at the whole world. And how down did it happen? We they work with country them around the world, we they support the government them for make them do what they supposed to do for push well body business go before. And we also they give the master sabi training, the tools them, the what they're supposed to do, how they're supposed to do and we they provide the advice where country they need for make sure say well body business go before. You know, then can say technical support. That's not the master sabi where country they need forget for make them go push well body business go before. That's not the technical expertise where they provide and they provide the tools them. The tools them actually means like strategies. If this kind sick day, how for treat them, how for handle them. For instance, also if somebody produce a particular kind of medicine, say even vaccine, they stage them. WHO they set the standard as to what you need for do for make medicine and which kind of medicine you for make. Then kind control measures, then they policy guidelines, waiting supposed to happen for make well body business go before. And waiting supposed to happen for make sure say people that not get exposed to things that will go give them sick and make them not get proper well body one.
All right. How important or significant them role way the World Health Organization they play to country them?
A very important, a highly important, because when I talk about setting standards, you not just want left everybody, for instance, they make medicine. Anyhow, let's talk about them vaccine, them like COVID vaccine. For make you produce vaccine, for instance, plenty other things, but I go use vaccine, for example. You know, they just you don't today say tomorrow morning I don't produce vaccine. Because now instant people them you they administer now people that you get for get a vaccine there. For make you vaccine actually go to the market and then for make them give people them. They get for go through certain stages. And whether they regulate that one day, now WHO, whether they make sure and approve then you whatever it is for medical product and all that thing in there. Now WHO, because now what amount that you get for give, we get for make sure say it meets the required standard where WHO don't set for say you need for pass through all them tests we they give you before you go put on at the market and even give people them. So setting the standards, providing advice to government, providing data and information to government, because now the master sabi people them, the scientists that the master sabi people them. Now then they provide the advice where country they need, right? For do what they're supposed to do. Me and you two not gonna know everything about TB, for example. But people then don't get the master sabi and then they work for the World Health Organization, WHO. So for make the country, for instance, Sierra Leone, able treat TB and know waiting for do around TB, WHO they provide them guidance and they advise plenty other things them where WHO they provide advice on and they produce set standards and policy and then norms and they waiting supposed to be, how it's supposed to be for make the thing go be very effective.
Okay, now talking about for set standard them, how the role of WHO don't tell like or don't be like in the midst of this COVID-19. What are some of the recommendations or the standards the way the WHO don't put in place for CSA we able for tackle the COVID-19?
Almost every day, WHO they provide information about the health trend, how the sick they go. Now down it they go, now up it they go, how it they go, which country they sick they more. That information, the data. We produce data on a daily basis and provide the necessary information to countries. So the emergency response to Ebola, that high-level policy decisions, that high-level policy guidelines, those strategies, and all them one in there at the global level with the provider one day, and from the global level presence at the country level with the provider one day, and even in countries where WHO not get a physical presence, WHO tools and guidelines and policies and strategies and standards they are being used in the country then they. So WHO they provide a leading role in the emergency response. Trainings, the guidelines, waiting supposed to do, and how for use, waiting for use for control the outbreak. All of those support have been provided. Now, if we can come even to the COVID vaccination where they happen, like I've been mentioned, where I talk about how WHO they support that one day. You go notice say the vaccine the way they out. Now WHO pre-qualify them. WHO they put them vaccine and they through certain tests where they're supposed to pass. Until you pass them test and the stages then the way you get for pass for make sure say the vaccine for instance safe. So the safety and efficacy, the effectiveness of them products and the WHO they regulate that one day strongly with no compromise. So WHO they provide them high level policy support and guidelines and advice today to countries. Right. So if you're talking about vaccination, the vaccine, the production level, for instance, at the production stage, WHO they make sure say all them vaccine and they go through all of the stages where they're supposed to go through. No compromise for make sure say they are effective enough for make Motamango use them.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel. FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget say this na your program Ctn Health Watch, where they reach you from a studio in Radio Mount Oriel. FM 107.3 for a big college. Inside today program, we talk about the work with the World Health Organization they do in Sierra Leone and the role where the organization don't play for help fight the COVID-19 and other sickness in the country. Me where they make the program reach you, my name na Zainaba Mansari. And with me na the program, I get Safia Boy, the communications officer for the World Health Organization. So now, Safia, we recently don't see the World Health Organization pull reports now the way they talk about the third wave of the COVID-19 virus. So make we talk about this.
So some countries and they really wouldn't they experience the third wave of the outbreak. Some country they would already go through that one day. Some country they were still in the second wave. But for Sierra Leone and Liberia, for instance, about first week June, now we don't begin see we on third wave. Right?
When you say third wave,
okay, the wave where somebody say we there for a second wave, third wave of the wave. Wave now if you look like way something they go up, it can down, it go up and can down, that kind of thing, stable. So if you be observed in late April or in April and May, we've been to get cases like 5 for day, 2 for day, 1 for day, 10 and day, right? That's not the all way to been to get na Sierra Leone. And by the end of May to early June, we begin see double digits and double figures. I mean, we saw the 2 and even 3 digits numbers of cases that now we don't see. That's not the wave. So it actually they happen where like the case it make like it don't go down. Then all of a sudden we see them back the numbers, then they go up. Okay. And this they happen because of several factors. For instance, people them can don't take them for granted. Say COVID done, COVID not there again and all that thing and the disease done simply because the numbers they go down. But the sick still they out there. So the advice is that no assume say it done until it is formally announced say it done. Until the government come out with a statement and say, hey, COVID done. Before that one they happen, for now we know say the sick still there. We are not out of the woods yet. We therefore continue with using our face mask we do in public places. you get for ensure maintain the physical social distance, and you get for continue for wash your hand. Just make the conscious effort for keep yourself safe and the rest of your family and the community and the general public safe.
All right. Same way, so if this trend continue, wetin you think say, or wetin the WHO think say could be the
It could be
next step?
devastating, right? Because we don't see countries the way they die in the thousands. We don't see countries the way they report, tens of thousands of cases a day. India, for instance, we don't see the UK been don't go through Ion. We don't see the US been don't go through Ion. We don't see South Africa don't go through, all the internet. So we no one reach that level there. This where we there right now, where we still the report, we don't begin report double digit and even triple digits. Where like you are now, we they report hundreds of cases a day. This not supposed to continue. So for make that one they not continue, we not get the kind of resources for allow COVID for take over we completely.
Okay.
Now that's make as a country we not get that kind of resources there, because now the hospital beds, are getting full. Now you get the ICU, the emergency units, then they get full. We no one reach that point where we health system will be overwhelmed by the sick, right? So for make that one day not happen, me and you get a role for play. Government they do in own part, they in well body partner, then they do their own part. International partners, then they support the country, but then they support the country because of me and you, and me and you self need for join hand day for make sure we actually achieve the goal and keep the numbers down by continuously doing them way we supposed to do. Use your face mask. Use your face mask always when you're in public.
All right, and now we don't the people they talk say WHO can just sit down no more. They talk say COVID-19 cases they go up just because of the no want for the
We work based on
virus
science. No, not science. Not to guess, not to assumption, right? Whoever they say that one they put himself at risk, and they also put whoever in they talk to at risk, and they put the rest of the society at risk. Because WHO, we operate based on science, and when we generate facts, right, investigated fact, not to assumption. And once you get an evidence-based science, then the evidence-based facts, and then you get for communicate that one to the public. You get for give the information to the public, because the public need such information for take decision, right? So in Sierra Leone, we they support the laboratory system for make sure say tests are done. And these tests are not done by WHO at the country level. These tests are done by the, people that are being trained for conducting tests and in a lab, not to be in the ocean and you don't do. And this is a specialized lab where then take your sample, that is then come take your sample and then go use the chemical then call the reagents under the kind condition they will then go get for find out for make sure say then see whether you get a sick or you not get a sick. So for the day, the target for Sierra Leone is to test about 1,000 samples a day. And now from them samples then they take, now from them result then they would get them cases here, right? So may nobody not sit there and begin assume, because if anybody assume and make sabi panti where they not sabi and they not listen to the experts, them the people that will sabi, the Ministry of Health, the government, they pull information every day. If they not listen to that, then they risk themselves. Not risk yourself for any reason, because you are so important. Your family need you, the community need you, and not risk yourself, because once you risk yourself, you're also risking your family. You're also risking the rest of the community, right? We all need to take the necessary precautionary measures for make sure say we not get sick. Use your mask. Get vaccinated. The vaccine they out there, it's free. Go and get your vaccine. The
And
vaccine safe.
talking about this vaccine, yeah, so how safe and effective it
The
is?
vaccine is safe, and the vaccine will help protect you, right? Even when you take the vaccine, you don't need mean say you get to go on the spree of not protecting yourself. Still use the mask, because now we get different variants that we can. That is, we get different type of the virus now. The virus don't mutate, right? That is, it don't change form. Now you get about 4 different types around the world, and we get countries that where the virus they kill people. It kill people seriously. So the vaccine safe. and it's advisable for make you make the effort and go out and find out outside the vaccine. They listen to the radio. If you didn't know your community, find out, go to a health facility and ask outside because not all the health facilities that the vaccination will take place, but it take place if you make the effort. If they're closer to you somehow, go and get vaccinated and protect yourself. If you take the vaccine and you get exposed, you'll be protected. You'll be more protected than if you not take the vaccine at all.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
So roughly, how many people in a salon you think say we do able for like get vaccinated?
We actually did about 1.3% of the people that we don't be vaccinated. The target is to go above 10 and 20, about 10 or 20%, but for now, not just about 1.3. That is to tell you that the progress is somewhat slow and the risk is still high out there, which is why you see we get more cases because of the risk is high. Make we get more cases. So the advice is that go out and get your vaccine. It's free. It better for make you protect yourself and be safe. Not listen to any rumor about the vaccine, right? This is coming from the government. This is coming from WHO. And look at other people around the world. The same vaccine they use here, 9 other people they take around the world. But if we vaccination low, that means the risk will therefore still remain high. But if we vaccination high, then the risk go still there, but even if you get exposed, somehow you get some immunity. You don't build a soldier man in your body for protect you.
And initially we been get target group there like the health workers and people that with them is get sickness that with them call underlying health condition. Then I be the targets initially for this vaccine. Is it the same trend or anybody can get the vaccine?
Now anybody can get a vaccine. Now there is a revised policy by the government. Initially the health workers, people that will get underlying conditions, people that were old. Underlying conditions, say for instance, if I get TB or if I get HIV or if I get diabetes, once you get an underlying condition, then your system not strong enough again. So anytime you get exposed to the COVID, it hit you hard, and mostly now them people then they can get a severe form of the sick or possibly even die, kill them. And even the older people, young children, toddlers, and of course older people, the immunity is not as strong as the young person, which was why the emphasis was on the older people, and then people get underlying conditions like non-communicable diseases and even communicable diseases where they affect them. But now, if you are a health worker, of course, you're not going to age. If you are a health worker, whether you are in your teens or you are in your 20s or 30s, you forget vaccinated for protect yourself, because remember, you come in contact with people there every day, people from different backgrounds. So now, if you are also 30 and above, it's good that you get vaccinated. Go and get your vaccine. If you don't get your vaccine, talk to your close person for making sure go try and get a vaccine. If also you use your mask, talk to somebody, talk to your close person, your loved ones, your family members, and whoever na you party and then your workmates, encourage them as well for make them go also use the mask.
All right, and now Safia, over to una recent activities where una undertake, like the polio vaccine and the Ebola campaign. Tell everybody.
All right, around December we been begin see a number of Peking them will fall with polio, right? And that number days from December to around May been get for increase up to 32. We been get for get 32 Peking that will get die and die foot. That is the polio. We get infected with polio and then get die and die foot, right? And this thing, now trend we done they happen now the region. You get Liberia, you get other countries like Guinea, Nigeria, other countries that are the region where we see the same kind of trend where we see now. Now Salon now we get 32 cases. And of course government say this not for continue, because once you have one case, it possible it will pass on from one Peking to the other. This thing starts with one. Right now we reach 32. That now because they come out from one pikin to the other. Because, polio they happen where pikin and they interact together. They affect mainly young pikin them. And, pikin them, then they play together and they sick they pass from one pikin to the other. Simply because then they interact. Now, fecal oral thing. Fecal oral means poor sanitation.
Okay.
It happen because of poor sanitation outside toilet facility. It's not controlled. And pikin and they, play around, that kind of thing. And once the virus in the environment, pikin interact with and possibly put an mouth, then it could be infected.
Okay.
So for make the trend of infection not continue, make pikin they not continue for get sick, government can the vaccination. And vaccination are the way that one they for tap the sick.
Okay.
So we were able to vaccinate a target group of pikin them where they below 5 years. That's about 1.4 million, but they're about, not the exact figure. But, those children were targeted in a campaign, nationwide campaign. Every site, every community, including you village, me village, and we all villages, people went there. The teams were deployed. We go from door to door, right, house to house, reaching every child in a marketplace, in a school, in a church, in all the community place, and they were vaccinated.
Somebody go on for ask, see how effective this is for protecting.
Oh yeah, very, very effective. In fact, the vaccine being used now, NOPV. So it's a novel polio vaccine. Very, very, very effective, right? So vaccination is safe. A very effective vaccine, not a medicine for me you make you well. Vaccine, nothing where they make you not get the sick. Once you get them, they get the sick again. But polio in particular, once you get a polio sick, they well again. Some time ago, you go ahead and say coco, then the cause and all this. But now that they happen because the vaccine they help protect them picking in there. There was a time around the world where you get thousands of cases per day. Right, but that they reduce now. So, but vaccine is very safe and effective, and it help for protect pikin them.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget say this na your program Ctn Health Watch, where they reach you from a studio in Radio Mount Oriel, FM 107.3 for a big college. Inside today program, we talk about the work where the World Health Organization they do in the country and the role where the organization don't play for help fight the COVID-19 and other sickness in the country. Me where they make the program reach you, my name na Zainab Mansari. And with me in the program, I get Safia Boy, the communications officer for the World Health Organization. Now on time for news. After the news, we come back and continue with the program.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
Welcome to the second half of the program Ctn Health Watch, where they reach you from a studio in Radio Mount Oriel, FM 107.3 for a big college. Inside today's program, we talk about the work where the World Health Organization they do in Sierra Leone and the role where the organization don't play for help fight the COVID-19 and other sickness in the country. Me where they make the program reach you, my name is Zainab Mansari. And with me in the program, I get Safia Boy, the communications officer for the World Health Organization. we dey continue with the program. Right, so is it the first time we una dey engage in such activity?
Oh no, of course. Polio campaign don't they happen at this country, like it's regular. You talk to any Combrai, go tell you about say they know about polio maclate, right? This don't they happen, and in fact, this one will happen this May, June. There's another one coming up shortly. Hopefully early July, the second round of the campaign will get for happen. So it's a regular thing.
So that second round, if possible, don't take.
Oh yes, you can still take
them back.
Yeah, you can still take. You can take even if picking and the way they get them first dose. For instance, if you just born in a hospital, even if now you born, you're always good for born in a hospital anyway, in a health facility. Then they get them the first dose. Even if you don't get your first dose day before yesterday or the day before, then this campaign starts today, it's still safe. In fact, the more doses you get, the more you are protected. So there's no overdosing in polio vaccination. If you don't receive and self the first round, it's even also better, good for me the pikin receive them back. So maybe then get the pikin back so that go get what we can call in Creole we say so Jaman and body for building body for fet the sick.
All right.
So that then it will get the immunity for help fet the sick if at all it come away.
Now to the recent Ebola vaccination exercise. Why the vaccination and how far this process don't go?
Inside February, I think it was February 14 where Guinean authorities announced they don't get the cases of Ebola there. Then one day an outbreak where the government of Guinea been announced. So what is Sierra Leone do now for get into action? For make sure say there was no cross-border transmission of the disease. That is the case not Comor Guinea and Sierra Leone. The relationship between Guinea and Sierra Leone, where they interact, even though there are international borders, but the people them along the side and they're not sabi waiting, they don't even know about borders. They interact freely, and we also get informal, porous border crossing points, people then they enter in and out. So the government see all that one day and say we need to take action, put them in place where we go make sure say we not get this Ebola case nas alone. So public health surveillance now like they observe and see waiting don't change. Any kind sign there, anybody they don't sick this sick with fever, Ebola, that kind of thing. So that continuous surveillance kind system there. And in the process you go able to identify other guess signs and symptoms with fever, Ebola, so that you go take samples and do tests. And community engagement, community awareness activities also happen. Then the government deploy rapid response teams at the border districts them, and also come up with plenty of strategic plans them way for make sure the country prepare enough and they ready for control any possible Ebola outbreak. But fortunately we not get none of that. But even then, the government continue with them activity, then they and institute the Ebola vaccination. And WHO being here for help the country for get some consignment of Ebola vaccine from Johnson & Johnson.
Okay.
Where now in the country they use right now for vaccinate health worker them. Now the 8 border district and then regional hospital them, including the one in Afrito, Makeni, Bo, and Potloko. And also the traditional healers. When people then sick in the communities, then get so much trust in the traditional healers, then can go there first safe. Sometimes they then can go to the traditional healer first before then can hospital. So for them traditional healer, then they know they're at high risk and exposure. They were targeted for vaccination. So once they are vaccinated, and even if they come across or even if they come in contact with the disease, the risk not will be too high. And also the Okada riders, then they go into the side the way motorcar they know they go, right? And then they take passengers across borders, and they know the road them pass, me or you tonight, or even the officials. So they were also targeted for this vaccination, and the turnout is, we get a good turnout from them, the traditional healers and the health workers that are currently being vaccinated. Okay. And that is happening in the 8 border districts.
So it currently they go
It's ongoing, yes, it's ongoing.
Okay. So coming back to the polio vaccination exercise, so many misconceptions there be there. People they say now because they want for reduce the number of people in the country, or now because they want for infected with COVID, now make them go carry the polio vaccine and all. So how far or how wanna be able for overcome these misconceptions?
These are rumors. People then can just they for throw their rumor and they for confuse people them. But COVID vaccine. Every vaccine very safe. Every vaccine safe. every vaccine safe. So it's not just about COVID, it's not just about polio, but every vaccine safe. So when government come with them services, then they now for protect the general population, now for protect the health of the country, now for make sure say we done away with them condition, then they and focus on development. So because whenever there is an emergency, the resources will for go in for do road, the resources will for go in for bring good clean water or light, the resources will for go in for provide good health services, then go spend that one day for take care of the emergency, right? So the vaccines them now one of the things that way will help stop the spread of them sick and day. And every vaccine, whether not COVID, whether not polio, whether not Ebola, whether not hepatitis, whether not for rabies, all vaccines then safe. It's not like say then come with COVID vaccine because they want, who does that? The only people will go come in and make them rumor than they now people will really just want cause confusion where they put people at risk.
Because I understand so you've been getting particular districts who say the people they all decide say they enough for take the polio vaccine.
Well, I'm not aware of that particular situation, but even if it happened, I'm sure that would have been corrected. So these are some of the lessons where we could learn for the second campaign, which is also why it's very important that the second rounds they come. Because for polio vaccination, it's good that all Peking get vaccinated. All Peking forget the marklet. Because if you Peking don't get the marklet, the other Peking not get the marklet, your Peking not 100% safe. Once then they play together without a Peking will not get the marklet, it's possible say you Peking say go there at risk, right? So then risk then they and we always they try as best as possible for make sure and tell people and say vaccine safe. Whether it's COVID vaccine, whether it's a polio vaccine or whichever vaccine it is. Just like I say, vaccine not a medicine for menu. Vaccine are for protect you in the first place. For me, you not go get sick, right? So may nobody not listen to rumors. If you want information, listen to government sources. If you want information, go on the website, WHO site there. If you want information, ask people them way know. Certain people, mostly in our community, then go, particularly with this WhatsApp, they make this thing deliberately for fool people them and put them at high risk, right? So not listen to information just from anybody. Because the other no sabi nothing about something when you begin talking. Not be a fool. You're supposed to be able to know so this person is just being it's just being troublesome. It just want cause problem and misinform you. So not allow anybody for misinform you. Listen to the right information from the right sources and protect yourself. Whenever there is vaccination, make the effort for ensure you get a vaccine or your family members then get a vaccine and not risk yourself at all.
Right, and Safia, the Ebola vaccine, we still they continue. How long this therefore take?
The Ebola vaccination will go for on for as long as possible until we're able to put this pandemic being we, because you cannot put a timeline saying that tomorrow morning or in end of 2021 we will go for done away with COVID. Once the COVID is there and there is need. For make people then get vaccinated, I think that one they go get for continue until we reach a point where we go say we are completely done with COVID. Remember, like polio, for instance, plenty country around the world been the report polio every day. You get thousands of cases. You get 5,000-10,000 cases. Some 30 or so years ago. But with vaccination, we're able to limit that number there. We don't reduce that number there. And for smallpox, for instance, we get done away with smallpox. We wipe them out completely using vaccine. The same way we get for done away with polio. The same way we will get for done away with COVID. The same way vaccine very good for protect you. Once we all don't get the immunity, once we all don't get the vaccine and we are protected, whether not against polio, whether not against COVID, once everyone is protected, then the sick not go get host. That is, it not go get sideways in good day. Because it meets you, it bounce, it not go affect you. It meets me, it not go affect me. Right? It will reach a point where we narrow down on them and crush them out completely. And that is the role of vaccination. And that is why it's very important for we all be vaccinated. And make sure, if not for you picking, may you pikin get the polio vaccine and every other vaccine ready for pikin. And for you, the adults, get vaccinated against COVID. The message here is all vaccine safe and effective. Then vaccine then they before them reach you, before them begin give them out. And they go through so much stages. The quality control for make sure say it's safe, for make sure say it will work, where they can say effective, and they go through all them processes then they. These are stringent control measures where there is no way anybody can compromise them. And WHO they ensure you go through all them tests and you get for pass them. You know, they pass them half and half, you pass them fully. For make sure say them they use that product say for administer them to people them.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget say this na your program Ctn Health Watch, where they reach you from the studio in Radio Mount Oriel, FM 107.3 for Abbey College. Inside today program, we talk about the work where the World Health Organization they do in the country and the role where the organization don't play for help fight the COVID-19 and other sickness in the country. Me where they make the program reach you, my name na Zaina Barmansere. And with me in the program, I get Safia Boy, the communications officer for the World Health Organization. So, as a country, who say you see we in the next perhaps 6 months or 1 year?
It's a very difficult. It's a very difficult question, right? Because we don't see in May we've been getting lower number of cases 1, 2, 5, 6, 10 cases. Now we talk about 100 and more cases, right? So it's a difficult one. For me, we go see we down that at that single digit number of cases in the country, or possibly zero number of cases in the country. It actually means we need for be vaccinated. Okay. We need for use with face mask all the time within a public, because when you use your face mask, you're protecting yourself, right? So that whoever they around will get this here, not go pass them, and if you get them, you're not go spread them also. And we keep the social distance. We take the measures, the advice, the way the authorities, the partners, the country, they give we, the master sabi people they give. So for us as to also as if we, I think I go wish. My wish go be for make we day at single digits. For make we able to control the sick, so that we all go able to gain with normal life back and go back to the normal way of living.
And again, we they ask people for get vaccinated, but again, somebody go want for ask the vaccine that we they available, then go enough for every Sierra Union.
The country get target. This is not just hard work. Then go take vaccine. Say look, then get a calculation. They know the number of people from 30 to above we supposed to get. So all the metrics, all that data they. Now based on that one day, then the plan. It's a planned thing. Then plan for them, the budget for them, and it's being implemented. Now the services day, the product day, the vaccine day for me, people then go take them. Right? Me and you too, your own responsibility. Now for me, you go and take the vaccine. Once the government, the Ministry of Health don't say this vaccine now, good. I mean, the stock where we get done, they go down, then go find way for bringing more vaccine. And the partners also therefore help the government for make sure say vaccine the supply day all of the time, right? Just so that when you go for service, nobody not go tell me say, I go for vaccine at this point where they say for go, I go then say vaccine or no, because the vaccine day, your role, your responsibility. Now for me, protect yourself by going to the vaccination site and get vaccinated. The rest, the government and impart them, we partner them, go find way anyhow, find money anyhow, resources anyhow, for make they make the service available.
All right.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na CTN.
From a general perspective, how you think, say, the work of the World Health Organization don't influence the Sierra Leone health system?
Oh yeah, well, we get very good, strong relationship with the health sector in Sierra Leone. There's a strong partnership, among the health partners, WHO, and the rest of the other partners, the UN family in Sierra Leone, and then the other health sector partners and the government. So there is that strong partnership and collaboration where they happen, and we all do work together for ensure, say, we make the required impact, provide the necessary capacity where the country need in terms of infrastructure, and also in terms of the capacity, human resource capacity, just so that we are able to provide the required services for the country. So the impact is huge. Capacity is being built and infrastructure are being developed. Above all, the partnership is very strong and, the guidelines are being produced. So all of that is in place and progress is happening.
So you think, say, when our operations don't help for in any way, shape, or strengthen the health system?
That is what I would say, because the essence for our presence here now for make sure the system is strong enough for able to provide the required health services. That is not to say challenges not good day. Challenges then they yes, but even with those challenges, we are seeing progress. A lot of progress is being made for push the well body sector go before in the country.
Another the way the World Health Organization can always emphasize on doing this COVID-19 are the issue of mental health. So as a country, you think, say, we safe get some of that challenge there?
During every emergency, the stress level they high. People they go through situation, people they go through stress way they're not supposed to go through if the emergency not there. Which is why under the NACOVAC pillars, you get a psychosocial support. And that now for make sure them provide a psychosocial, that is, then talk to people the way they go through stress during, even if you are under quarantine. That itself is stressful. If you're sick, that itself is stressful, right? And if you are limited, for me, do the things where you're supposed to do freely, that itself can be stressful. So all the one they get the mental health aspect of them way they affect people them. So the country very much aware of that. And you get a psychosocial support team where actually the government set up for provide counseling to people them. So it is true that it's no doubt that the psychosocial aspect is very important in emergency situation. Now, one critical factor anyway.
Okay, so now in planning the second round of the polio vaccine, like you mentioned earlier, waiting are some of the things away. Una think say una don't take note of way una things in a things away una go back and readjust again for the second round. So una know get the challenge una been get the first round.
The first round has been very successful. I have to probably emphasize that more. That the first round was very successful and the acceptance level was very high. You may have one or two refusals here and there, but that is actually not as significant as the kind of gains where the campaign make. Because reaching, even having the teams, training the teams for me them go to every household in Sierra Leone, that is remarkable success. Making sure that all them picking and they were not even they out of house, where sometimes either then go school or then at some playground they are all vaccinated. That is a success. And making sure that the community itself then gets involved and supports the campaign, that itself is success. So the few challenges like resources where they happen here and there, where for instance, because then campaign here then require huge resources, right? So resources now one of the challenges because the country need that kind of support. So maybe that now way some good planning could therefore be done towards that. Even though the first one was planned for that, but of course, once you implement, you identify some of the issues and the issues of refusal, I think, are also being looked at because after the campaign there was a review. to look at waiting happen, waiting at the successes, and all of the minor challenges that were there have been identified, and at them issue then they also are being worked on for make sure so they not happen again.
Okay.
But we, even if
And
they
like
happen,
the issue of refusal, somebody go on for say maybe the sensitization be kind of like poor or like
decision
enough.
making. The sensitization has been enough because this is not the first time. Well, challenges go still there.
Well, people in the race concern say most times we can stress more for sensitize people them na free tongue, and we can pay less attention to
waiting the happen with them campaign. Waiting the happen with them campaign then they even for us, let's talk about the jingles where they go down play at this radio station here. Have been done in different languages, and Sierra Leone is blessed with the fact say.
But how far
Sierra Leone is blessed with the fact say we get. You know the number. If we get close to 50 or probably more radio stations, and some of them are community radio stations. And we also get structures them across the country. We get village development committees. We get district health management teams. We get chiefdom level health committees and all that one in there. So at that level, then they activities then they happen. So even sideways the radio wave, not the reach, you get community mobilizers at then level, then you get community health workers, where then at then level, then they do one-on-one community engagement. This town crier, where then they use a mic, this loudspeaker, they pass and announce. All of that is happening. So it is not quite true, say, the concentration not just in Freetown, but I think the fact is a lot is being done for reach every side. So which is why we can always say, when you hear it, you go tell your neighbor, because this not good news. Not just keep the good news to yourself, because if your neighbor self hear about them, in Peking go get the marklet, and once you Peking and your neighbor Peking get the marklet, then all them Peking then they safe and are protected. But not just say now you don't Peking or you hear, pass the good news to your neighbor as well, because all the Peking them need for be vaccinated.
Okay, so with all this way we don't talk about what would be your message or
my message starting with COVID now for make sure say make people them let you safe, and once you let yourself, extend that likeness state to your family members, extend that likeness state to the rest of your community. What to make us say that is because if you are protecting yourself using the mask, if you protect yourself by getting vaccinated, get the COVID marklet, then that shows say you actually show the love where you get for yourself to the rest of everybody. We're going to encourage people for use the mask and social distance and hand washing. Not forget for wash your hand, because we touch different things. You enter public place, you enter motor car and all that thing. You touch things where somebody else don't touch. You don't know how that person they don't handle that place there. So it's always good for me you protect yourself and get vaccinated. And not listen to rumors, because rumors they go spoil your mood, they go confuse you, and it go make you take the wrong decision. And for COVID also, if you're not possible to smoke, I go advise you cease smoking, because smoking they damage your system, and once your system is weak and damaged, if COVID enter there, it will overcome you and it will get severe form of the sick, and who knows what thing will happen after. And for all health services, if family people then go now hospital for go get the health services, the services are available and are for you then they. So go now your nearest health facility, now your clinic near you, now the hospital near you, and get the services where you're supposed to get. And that also include the vaccination for picking them. And if you need for you get belly woman supposed to go born a hospital, all them services then they. So my advice is use the services where available and listen to the right information. Not make anybody misinform you.
That's Safia Boy, the communications officer for the World Health Organization. Well, now so I go draw the cutting down for today's Ctn Health Watch program. Plenty thank you for wanting to join me in the program. In case you miss part of the entire program, tune in again Monday afternoon for a repeat broadcast. Me we don't make the program reach you. My name na Zaina Barmansere, they say tata.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Ctn Health Watch. Ctn Health Watch, your well body program.
This na Ctn.